Sylvia Worden. I'm a nurse practitioner, and I'm also the administrator of the Orange Coast College Student Health Center. I really strongly support single-payer health care, but I'd like to tell you a little bit about my health center, which I think is a really great model for health care, and it also shows how high-quality, low-cost health care can be provided. We have the students pay $16 a semester, and we have approximately 26,000 students. So that comes out to a lot of money. It pays all the salaries for me as an administrator. I have 3 registered nurse positions. We have a janitor. We have a couple of clerical positions. And then I hire physicians and mental health therapists on an hourly basis. So what we do is we use our registered nurses very, very actively to triage problems that come into the clinic. You don't just walk right in and go see the most expensive practitioner right away. The nurses will take a history, they'll do a quick exam. If the student has a problem that's beyond the capacity of the health center to address, they will move that person on into a different healthcare setting, perhaps call the emergency room, or send them to an urgent care center. If they have something that really isn't serious enough to warrant a physician visit, they actually may give them some handouts, may teach them some self-care techniques, and then the student will be maybe rescheduled in a couple of days if they're still ill. So we use the doctor's time very, very carefully, and we manage that very carefully, and we use our registered nurses very, very actively. We do the same thing with triaging into our mental health therapy appointments as well. So anyway, thank you so much for listening, and I think that would be a wonderful way to, kind of a model to provide sort of a basic primary care service, and then have an insurance program that could provide hospitalization.
Hi, this is Ben Garizzi. I'm a general contractor and engineer, and last 30 years I work in this country, and still I don't have a health insurance. I have a family of 4, 2 children and my wife. We don't have a health insurance, and we are really worried about the future, what's going to happen. When we compare this country to the other third world country, we are in worse position. And I hope somebody wake up or get up and do something about it before it's going to be too late. Thank you, and I appreciate it.
Healthcare means different things to different people, but for somebody like me, it means life or death. And a public option will guarantee healthcare for people that are missing on something that's vital to for the general public. Basically, it also means freedom for somebody that's permanently disabled like myself. We might be able to get away from the social economic prisons that we're in right now. We need these options so we can change our lives.
Hi, my name is Jim, and I'm here because I'm concerned about health care. I work for a medical company, but I know there's a better plan out there than the one I'm on now. I don't know what that is. I'm hoping it's single payer because I believe that's the best system. However, I haven't really checked into it all that seriously myself, but I know my company's paying top dollar for the insurance they're giving me, and I'm sure that's true of everybody else who's employed by my company. And so that's why I'm here. I'm concerned about health care, and I want to see a reasonable plan put forth.
Hi, my name is Ahmed. I graduated here from UC Irvine a few years ago, and my story is that my brother, who also happened to be my hero and my best friend, passed away suddenly 2 months ago of a treatable condition. He was born with a single ventricle, and so his body always lacked oxygen, and he had he had a lot of fainting spells and all that kind of stuff. And my father couldn't afford insurance for us because he runs a struggling small business in a rough neighborhood. And the only health insurance my brother was able to get was when he was a student here at UC Irvine. And that insurance is also very limited because it does not necessarily cover pre-existing conditions. So my brother went from emergency room to emergency room after every fainting spell because there was no primary care physician. And every time the emergency room folks would ask him if he has a primary care physician, he would say, no, he does not. So in 2007, late in 2007, while he was at school here, he passed out in the elevator of the parking lot on his way back from class. And the emergency folks came and they took him to Irvine Regional Hospital, which has now been closed. And they wanted to admit him, but his insurance wouldn't cover it. So they transferred him to a charity-run hospital up in Orange, a little further up in Orange County, and there he received an emergency pacemaker installation. After which he was released just a few days after, when he wasn't even able to walk because his health insurance was lacking, and he wasn't able to get the regular post-operation follow-up that would be expected after an operation. In fact, the week after the surgery, he developed a very dangerous and painful clot in his left leg, and they had to run him to the county emergency room up in Los Angeles, where he received some blood thinning medication and was released with no affordable follow-up options. Tomorrow the university is going to honor him with a posthumous bachelor's of arts degree in sociology, criminology, law, and society. And 8 of the professors here have nominated him for the annual Chancellor's Award for the Living Our Values Award because he used to volunteer all the time in the community, and he's a good guy. I think his work will continue because I'm going to make sure that it does. But I think it's unfortunate that a broken healthcare system might have denied him his American dream and denied us the opportunity of watching a truly inspirational story unfold. Thank you.